My name is Evelyn Towgood. I'm a local businesswoman in Quesnel, BC, and I've invited my friend Melanie MacDonald in from Seasons House Shelter. Melanie and I have been friends for a long time, and there's some questions in the community that are misinformed, and I just wanted to ask Melanie on camera and in interview some of these questions. Melanie and I don't always see eye to eye on all of the issues, but we're always super respectful of each other and trying to find solutions that work for everybody. So this is Melanie, and I'm going to start off right away. There's been some questions around the fact that there's no curfew at Seasons House and that users can go in and out as often as they want, day or night. Can you shed some light on that one?
Sure. I don't know that I would call it a curfew, but what we do at Seasons House is we close our doors to the public at 9:30. People who access our emergency shelter program can't come and go. They forfeit their bed if they come and go. That being said, somebody can leave because we can't hold them. We can't confine people. So some people do choose to forfeit their bed. We strongly discourage people from coming and going, though. We can't do that. And one of the reasons we can't do that is because I'll give you last night, for example. We are severely over capacity at our shelter. So my 15 beds are full and I had 17 people sleeping in overflow. So that is 5 mats and the rest of the people are in chairs in an office, in a space about twice the size of your office here. It's really difficult for people to sleep if people are coming and going. At the same time, it's not that black and white because I have 17 people sleeping in chairs in a space like this. Some are in chronic pain, some are mentally ill, some have brain damage, some people use substances, people are in crisis because they're homeless. And it's not an easy environment to sleep, and so people need to get up and move around. So it's not always black and white. People do come and go sometimes. The other piece is that it's not just the emergency shelter program that we operate at Seasons House. We also have rental units there. We have individuals who rent with us for up to 3 years in those units. And they are paying tenants just like anywhere else in the community. And they can come and go as they please. They are no different than any other tenant paying for rent in a location.
Thank you for that, because I know for me, that was a huge misconception that I didn't realize that there are different types of beds or facilities available there.
Yeah.
And I think that one is super important for Quesnel and anybody that's watching Quesnel to know that there are actually 3, right?
Yeah.
3 different types of
programs there. The other thing I want to say is that we have a huge group of individuals right now living outdoors. We have people that, this is new to us in the last couple of years, and it's really difficult for us as shelter providers. We have individuals in our community that we can't provide services to because their mental health issues or substance use issues are too complex for us to deal with in an overcapacity shelter environment. Sometimes we're experiencing the same issues of theft with them too. So we have a larger population of people than we've ever seen restricted and living outdoors. And lots of times those individuals are out and about at night, and we know that.
And would it appear that those could be your clients?
Absolutely.
But yet they're not, because you don't let them in because the capacity is too full, or you don't let them in because they just have caused too much disruption.
Absolutely. I think that the community often feels that anybody who is homeless somehow belongs to us, and it's just...
I'm guilty for that too.
Yeah.
Absolutely. I'm so guilty for that, and so glad that we chatted about that, because I don't know why I thought that, but I did look at the community and go, oh, these are shelter users, and again, didn't know that there were actually rental transitional housing in there at all.
Yeah. The other piece of that is that I just want to say is that for individuals who are living outdoors, sometimes they come and use our washroom facilities at night. There is no public washroom facilities in our community. And I just had a chat with my graveyard worker about this the other night because I was really trying to gauge what was happening because I keep hearing this frustration in the community. And he said, well, no, Mel, sometimes, so-and-so comes and they need to use the washroom and I can't, they just want to use the washroom. And if it's not disruptive to people in there, then he's going to let them in. People need access to bathrooms.
Well, again, it's something that, like, for myself, and I'm sure a lot of the community, is you are seeing human feces and urination happening out in public spaces, and we tend to get very upset about it. But like you say, it does make sense. It's sad, but it also does cause anger for the rest of us that want to walk down the streets and not have that.
Yeah,
so it is a complicated situation.
It's complicated.
So another question is, a few citizens and business owners have indicated that, Seasons House tends to be a bit of a safe haven for thieves. So if they steal some goods and they go down to Seasons House, almost like they're kind of protected there.
Yeah.
And they're stolen goods as well. So I was hoping that you would speak on that too.
Yeah, absolutely. It's been really sad watching that unfold and those rumors happen in the community. So if somebody comes into Seasons House with stolen goods, we contact the RCMP. We willingly share our video surveillance with RCMP all the time. All the time we're doing that, whether it's an accident on front or on the street outside to anything that happens indoors. We have a really good relationship with them. If somebody comes in and we suspect they have stolen goods, we'll pull it in the back and we'll contact RCMP. The reality is that doesn't happen a lot. Like if somebody is staying at the shelter and if they're out and they've stolen something in the community, generally it doesn't come to the shelter. It's going to disappear before they come back and re-access shelter services. We do whatever we can within our ability to stop that.
There's some connection that, like we've kind of covered off, that there's this homeless population that you don't serve, and we all tend to, as residents, assume they're all yours.
Mm-hmm.
Is there anything you can speak to around that all of the criminal action that's occurring in our city isn't necessarily being done by the homeless population?
Yeah, absolutely. I think that the homeless population quite often is looked at is kind of scapegoated for all of the criminal activity. I do believe there's a segment of that population who is out there desperate and committing thefts and crimes for sure, but not all homeless people are criminals by any means. Not all people who use substances are criminals, and we need to, I guess, stop speaking in absolutes.
I think that is the best point.
Yeah, homeless people they're varied people. It's an entire population coming from all different places, right? And many really, really beautiful people. So yeah, I think we need to stop speaking in absolutes.
I think there is a big change in, certainly from people that I'm speaking to, mm-hmm. that we do recognize. So if I'm speaking on behalf of, say, business and tax-based people that I visit with and talk to, there is definitely recognition that there is, lower level petty theft and then the higher level of theft.
Yeah.
Would you say that the severity of crime in Quesnel, in all layers of it, is adding to the stigmas that your population that you're serving are having to, basically wear the badge of all criminal behavior, even though?
Absolutely. And I guess one message I'd like to get across, and I like to tell this to business owners when I'm talking to them, if you feel that somebody at Seasons House has stolen from you, give me a call. Come see me. Come talk to staff, because we're going to try and get your item back for you if that's the case. Or we're going to share that share surveillance with RCMP, say if somebody walking in with an item or wearing an item, we're going to do that. The only time somebody would be asked to leave is if they came in and started yelling and shouting and ready to, knock people's heads off.
Sure.
looking for something, right? So
if there was a time like the present where criminal activity, you know, we're number one in BC, we're number 3 in Canada on the crime severity index. Do you think that because we're not seeing a lot of prosecution and proper justice being handled, that people are tending to do crime more often and at a higher pace because they don't feel there is any consequence?
I don't attribute it to the justice system. What I attribute people's desperateness to is decades of underfunding to housing, huge lack of food services in our community. I mean, a year and a half ago, we had to cut our community food program, and that was 40,000 meals a year that fed really hungry people in Quesnel, and we don't have that anymore. I think it's decades of underfunding to absolutely necessary healthcare services and support services from trauma care and counseling to detox and treatment, which is like really non-existent here in our community for people. I think decades of not having a proper poverty reduction plan in place is we're seeing the effects of that unfold. These things did not occur overnight. This crisis in our community didn't happen overnight. We're at a boiling point now. But I know that for me, as a service provider, I've been watching this unfold for years, and it's been devastating watching it unfold. But I do believe that the desperation that you're seeing and that crime isn't attributed to a failing in the justice system. It's a failing of multiple systems.
Okay, I appreciate that. I think that I've learned a lot from you in that respect. And I think that the community is at a boiling point, but I also think it's at a boiling point because communication hasn't been there or hasn't been effective. If it's been there, it hasn't sunk in and hit home for a bunch of us. And what we're finding is, you know, everybody feels that they're working their hardest and doing their best. And now you're taking on even more expense. So you might think you're living this mostly honest life and you're generous and you're donating to charities and doing what you can. And then you're dealing with theft and you're dealing with vandalism, and it's causing you even more. And it's hard to come out of the anger and be at the table to talk about what is necessary to start to push this back into a controlled environment.
I think too, part of the misconception is that there's like this huge divide between people who are feeling fear and want to protect what they've worked so hard for. I'm one of them. And people who are sitting in the social arena and have been watching this unfold, and some of the injustices occur for vulnerable populations. But that divide does not need to be there. Like, we need to come together and talk, because it's not both of us on both sides have the same interests. Me as an employee at Seasons House, all of the team at Seasons House is completely invested in this community. We love Quesnel. We care about Quesnel. I have staff that are retired and have master's degree and are working there because they love the work and they care about the community. Staff who are farmers, staff who own other businesses, staff who are teachers, they're employed at other places. All of us are good people. We're hardworking too, and we're really invested in this community. And we can come to the table professionally and talk through things. I'm so willing to do that.
There's so much right fighting that goes on with different polarized views, of course, across the board. But I think it's so important for people that are maybe feeling really, really stressed out about this and self-righteous about it, that it's important for people even in your spectrum that have been engaged and have been educating yourselves along the way. I think the patience is required for that side, if you will. Like, I hate to say there's a side because I don't think there's two. I think there's many. I think everyone deserves a seat at the table. But I think if there was a little bit more compassion on even that corner of it, to have some patience with the frustration. Right? And there's been some disengagement. You know, everybody works hard and they got their blinders on, and that occurs. And we get to a point like this. And for me, it's so important that we all sit and we all hear, because there is something that I can learn every day, but I'm also not wrong. You're not wrong. I'm not wrong.
And I think part of that, Ev, and I just want to respond to that, is that you have, you know, people from businesses and community residents, not sides, but, you know, over here, and you have people in the social spectrum who are coming back sounding just as frustrated and angry. And so people on this side are feeling that fear, wanting to protect their investments and everything they work for. And people on this side right now in the current context are literally watching people die around them. And so a lot of those comments aren't coming across as patient and caring. They're coming across as desperate, right? We're fighting for our lives out here. We're fighting for people's lives out here. And it's been so much headbutting. And you're right, we have to stop that.
We have to.
And we have to have patience, and we have to learn to listen to each other.
And we have to know that we all want this same outcome. And how we get there shouldn't matter. How we get there should not matter. If we can all be respectful and kind around each side or views, frustrations, we're surely sooner to get there than if we keep these polarized pushes where we're just not willing to listen. You know, and so I think that what we can do, because we're so different and because we come from such different areas, and none's to say that I don't live a stressed out life and you don't live a stressed out life. It means to say that we've both been in tunnels with tunnel vision, and it's time for us to stop, take a breath, and listen to each other, and really truly try and be a part of the solution, even if it means pulling pieces out that, you know, the tax base can wrap their heads around and hearts around. You know, if it is around food banks or it's around anything like criminal behavior being prosecuted, if we can come together at that table, I just think that we can do it all. Like, I really do. I think this is a community that when somebody is in crisis or need, it rallies. And to be painting all of criminal behavior and all of homelessness and all of addiction with a brush is just detrimental. Like, it is not what we need right now. And when you talk about addiction, we all know that addiction doesn't just live in homelessness. It is absolutely living in homes of the rich and of the poor, of the motivated and of the depressed and despondent, right? So when you look at something like that and you're criticized because the brush has been stroked so broadly, and people say that Seasons House is a flop house with no rules, can you explain how you operate so that people out in the public know that there is some sort of intake or some sort of process, as you will, that you don't just open the door to anybody without any kind of check or
absolutely. We're not a flop house. I think one of the things that the community needs to understand is that homelessness is on the rise everywhere. And when people come into our services, we work really, really hard to move them through the continuum of housing, from shelter into housing. The reality is we're in the biggest housing crisis our country's ever faced. And that's why you're seeing homelessness rise, along with a multitude of other complex issues. But we're in a housing crisis. We do have a homelessness prevention program where we can provide people subsidies, people who are living in poverty, to get housed out in the private market. That is one of our most successful programs, but it's limited and it's got a wait list and it's full. And it's really just reaching the very tip of the iceberg of people that are in need in our community. piece around us being often called a flop house, I think is in regards to some criticism that we've experienced around our minimal barrier philosophy. We operate from a minimal barrier philosophy, meaning that we try to keep our doors open to as many people as possible. Quite often people who experience homelessness, who are struggling with mental health issues, might not be med compliant. People who are using substances aren't able to access other services. Our philosophy is that we want to keep those doors open to people. We want to prevent people as much as we can from sleeping on the doorsteps of our neighboring businesses or in bank vestibules. We want to bring people indoors and provide them with wraparound supports and try and do case planning with them to get them the assistance they need to be well. Minimal barrier literally means flexible appointment times, and people can bring their pets in with them if they want. It's about meeting people where they're at. It's not about not having rules. It's minimal rules. It's flexibility with people. It's recognizing that people are individuals and we're going to be as creative as we can to work with them and to get them indoors and to try and put services in place for them.
Okay, so maybe if you could also then, that makes sense to me. It scares me a bit, to be honest, because it does sound like anybody, anywhere, anytime, and me being from the place in my life I'm at, that does sound scary to me for your staff and for the other residents. But tell me a little bit about what kind of intake process you have there.
Sure. So when somebody presents at the shelter, it's a BC housing intake process. So we collect some basic information for our database system. And then what we do is some case planning services. So we look at what's happening for the individual, why they presented, what needs they have, what services we can help them access, what goals they have, what are their immediate healthcare needs, those pieces. So when somebody comes through our door, we go through this process with a case manager and we do case management planning. We also do pieces like we go over the guidelines, the rules, the expectations at the shelter. We are very clear, there's no violence, there's no abuse, and that will lead to somebody being outdoors. So when I say that we keep our doors open and we accept people where they're at with lots of complex needs, people will come in and they might not be med compliant and they might be very mentally ill, but that doesn't mean they're dangerous. It's when somebody is presenting as unsafe to other clients, unsafe to staff. If they're violent or they're abusive, they're out. Okay. And that is a really clear line that I draw for other residents and for staff safety.
So the misconception that's out there, I think this is in more than our community, but it's out there that individuals are being bussed here. They're showing up in vans or buses. They're coming from other communities that maybe are outside of their own abilities to handle, and they're being basically dropped off here. Yeah. So what kind of comments can you tell us about that? I think that one is, at the height of its concern level, because you're hearing it not just in Quesnel, but you're hearing that in other small or northern cities that this is occurring.
Yeah. Absolutely. We do not. I will absolutely squish the rumor around busloads being shipped to the community. That rumor has been reoccurring over the years since the day we opened our doors. BC Housing in the province does not ship homeless people around. I think that where some of that comes from is people see new faces, and they might not be new to the community. They might just be new to homelessness or to the street, right? There is some transient population for sure. We've experienced a rise in the transient population that travels usually through northern communities, not necessarily from the coast or other areas. There is a rise in transient populations that we've experienced in correlation with our public health emergency and this opiate epidemic. But the majority of people we provide services to are still local, or they have family here. They've come back to Quesnel after leaving for many years because they have family or some other roots here.
So we as a society, we seem to focus on what isn't working rather than, like in these tough situations, rather than what is working. What would you say are some of the positive things that have come out of Seasons House or Seasons House initiatives?
Yeah, definitely one of the best successful programs we have going is our homelessness prevention program. That is a program that actually gives us the tools to get people housed out in the community. So we provide rental subsidies to individuals. We work with, we have multiple landlords in the community that we work with and have great relationships with. We house people out in the community and try to set up as much supports for them as possible to make sure that they can maintain their housing and they're successful. So housing first leads to stability and health in people's lives. Without housing and living in shelter, you're constantly living in a state of chaos, right? There's no safety or security, and so is your community. And so housing first works. I can't say it enough. Housing works. And so our homelessness prevention program is a huge success. We need more housing subsidies so that we can expand that program and house more people. We also have embarked on a number of employment programs in the last few years. One of them was our Rebuild Junction, and we have the Clean Team. So what those are, this is a huge gap in our community that needs to be met. Those are opportunities for people who have experienced homelessness, who have mental health issues or substance use issues or lived experience, who have barriers to employment. It could be cognitive, it could be a criminal record from going this revolving door system. And so it's providing people with the opportunity to connect to the community. It's providing people with the opportunity to feel like they're worthwhile. So it's providing people with the opportunity to feel connected to the community. It provides a sense of self-worth, a sense of belonging into the community, buy-in. So creative employment programs are absolutely necessary.
I think those are what the tax base needs to hear about and see more of, because that anger of, like people just they don't have to work for anything, they don't have to be a productive member of society. I know people use the Rebuild Junction. I know that we see the Clean Team. How can we see more of that so that our patience level can go up and our acceptance and, removing some of that stigma? What needs to happen for the tax base to see, some down and outers working hard to be productive? Mind you, their mental health, mind you, their addiction. I think a lot of people would have a way more accepting view if they seen a little bit more of that.
Yeah. So there's a couple things with that. People literally, when I have my gift cards and I have work to do, people are lined up wanting to do that. People want something to do, and people want to feel like they're needed. They want to feel important, and they want to feel accomplished. And so that is a misconception that people don't want to contribute.
And I need to hear that.
Yeah.
I need to hear that.
Like literally lined up. So I think what needs to happen is we have to come to the table and we have to work together
and
to create opportunity.
Sure. And like jobs that maybe aren't 9 to 5 or have to be's, but they're jobs that we could see, just some elbow grease and commitment from that part of our population to the other.
One of the things we've always dreamed of, and so do the guests that we serve, one of the things we've always dreamed of is like a pick up and go service. Like you You can be ready for work at 8 in the morning. You can go to work for the day, get paid cash at the end of the day, and then you're done. And you know what? Somebody might show up for that maybe 1 day a week, and maybe 3 weeks from now they're going to show up 2 or 3 days a week. You know what I mean? It's creative. You've got to be ready to go, have a bag lunch with you, and off to work you go.
Yeah.
And so those pick up and go opportunities, other communities have done them, and they're very successful.
I'd love to sit at that table. So another question that I have for you is, because it's not clear to me, is there a detox center in Quesnel that people can access through public health, or is there only private opportunities? I don't understand. If somebody does want to actually go through and a detox, what do we have here?
Yeah, detox is like jumping through hoops for people. It's really difficult to access. There's limited detox through the Quest unit in Quesnel. It's more for, alcohol management is my understanding. And if you have a physician that you're attached to, for the population we serve, they don't always have physicians, and a lot of physicians don't want to work with them, right? Because they're complex, they're difficult, can be difficult. The other piece is, so when we send somebody to detox, we usually have to send them to Prince George or Williams Lake. There's facilities in both those communities. It's usually a wait time to get to them, and you have to figure out transportation.
Is that by volunteer?
Yes. And so what happens if somebody's ready to detox, when they come to you and they say, I'm so desperate today, I just need a change, I'm ready to do this. They might not be ready in 2 weeks when that bed's available and when everything is organized. And so accessible, timely access to detox is really important right now in this crisis.
Not here.
And it's not here.
Okay. So in saying that, is there, and I'm not at all a professional anywhere near any of this, so excuse my ignorance, but is there a way, if you need methadone, is there a methadone option for you in Quesnel, or is that another one where you have to find a volunteer that would take you? How does that work?
Yeah, we do have an OAT clinic, opiate antagonist therapy clinic, offered at Westside Mental Health and Addictions.
Oh, okay.
So that is available in the community.
Okay.
Yeah.
What are the injections that we hear about that maybe used to be done in town and now they're being done sporadically by the psychology nurse that's been hired? It's I can't remember what I've heard it called. It's like an antipsychotic, or I believe it's attached to a mental health disorder, not so much an addiction. But there's been rumors that I've heard where it used to be done and now it's not being done, or now it's being done maybe by the street nurse that we've heard a little bit about. What is that?
So I don't know if I can speak to all of that, but what I do know is happening is there's a new service in the community, a psychiatric liaison nurse who works with the RCMP for 4 hours a week. And she goes out and she does reach some of the population who are due for injection antipsychotic meds. And she does get them on an outreach basis. So it might be hard to get them into the hospital. It's necessary to have them on those injections for their well-being and the community's well-being. And so she's doing that on an outreach level to make sure that they're getting them.
So is that somebody that needs it, that may or may not be a substance abuser? Is that it's attached to a different mental health?
Could be both.
Okay.
It's a really complicated thing,
Okay.
and it's probably something you'd want to ask an expert about. That's a great service in our community, but it's 4 hours a week, and I have to tell you, we could use an entire team on the streets in our community right now doing some sort of outreach at some level.
The location of this shelter, it seems to be just such an infuriating piece of our issue is around the location of it. Because for me as a user of the city, I live in the city, I work in the city, it's such a busy intersection there. Yeah. It's, surrounded by some amazing history, and it feels like a place I don't want to go. because there's such a population there that is scary for me. Like they do intimidate me because they do appear to be in numbers and sometimes be in mental states that don't make me feel comfortable.
Yeah.
And I know there's been a lot of accidents even on that intersection with where they are. And of course, listening to you that you're so overcapacitated. Do you think that's the right location for this shelter?
The location it's got pros and cons to it. The pros to it are limited. and what they are right now is that the location is close to essential services, so close to the food bank, close to the hospital, close to the downtown where people need to be able to access other services. There's far too many people accessing services in that location. We're too over capacity. It's a very busy roadway. We would love to be in a different location that wasn't so busy. I worry every time I hear brakes and that somebody has been hit. So yeah, it's problematic for the community and it's problematic for us. The other piece is that I'd love to have a facility where not only everyone had access to, at the very least, a bed, but some space, right? Because I'm literally sheltering elders with dementia and people with chronic mental health issues, sometimes sleeping in a chair beside each other at night. And so what would be nice is if we had a separation of space for individuals, if I could dream up exactly what I wanted, higher barrier space for people and a lower barrier space. And so, yeah, to get back to your question, no, the location and the building itself does not work. We would love if we could dream of something else, something better that served the community better and served the people that we serve better.
So if I could add to that, when I say that there's, typically in the day, there's a large population around the shelter, that intimidates me. So again, that could be my ignorance, my fear. And I do donate, especially at winter, I do. Is there any reason why, if I want to, donate after an event where I have extra pizza or I have extra food, is there any situation like that where we should feel like we can't just walk on in there and drop it off?
No.
You don't think my safety is at risk?
I've worked there for almost 9 years and I've never been harmed and our staff aren't getting harmed. I think that I think for an outsider, the population does look pretty scary, and we've had some incidences there and in the vicinity where it's like, you wouldn't want to step in the middle of it. But do I feel like you would be targeted or attacked if you showed up with food? No, actually, I think what I get from the community is that people are really genuinely surprised and pleased because people are opening doors for them and helping them pack stuff in and greeting them with genuine thanks and appreciation.
Okay.
Yeah.
Yeah, I think I have to admit that I do think that I know it's unfounded that I feel that way, but it is something that is like in my gut. I'm somewhat, a little bit afraid.
Yeah. I think they can, it's sometimes I need to step back and remember where people's fear is coming from. I've been with this population for so long and I love them and I feel very comfortable and safe in a room with the people that we serve. But I remember my first few days, my first few shifts at the shelter when I came through with preconceived notions. Mm-hmm. And I still had bias and I still had some fears and they're just not always real. And
I think that we need to hear from that too, because if we are victims of crime and vandalism, you tend to create who that is. You create that they're scary people, that they're violent, that they're all of these things because you've been victimized. Yeah. So I think it is helpful for people like me that have experienced a bunch of crime over the last few years.
Yeah.
And we've lumped it into that stigma that we hear from you on those things, and that, you know, we challenge ourselves to put ourselves in there just to see what that experience might feel like. So, what kind of community programs, when we were discussing about like even the working that we want to see some of these individuals doing, what if there was somebody out in the community that, you know, decided, okay, enough is enough, I'm gonna, you know, get a little group of my friends together and we're gonna volunteer, we're gonna try and do something to help. What would be what would be your recommendation? Would it be something around food services? Would it be around employment? Like, what do you think the average person that, you know, doesn't really know where to even begin to help, if they started to feel so inclined that they did want to participate at some level, where would their time and energy and maybe some money be best spent?
For me, I feel like the first, not first or second, but one of the priorities would be some creative employment programming. The other piece would be food.
It would be food.
It would be food. It would absolutely be food.
Can you tell us what services are available for food in this town for people living on the margins? Maybe they're not even your, your residents or your users of the shelter. What are people who are living, you know, either in poverty or on the edge of poverty, what can they access for food in Quesnel? That you know.
Yeah. We're very under-resourced for food services in Quesnel. Salvation Army provides food services 4 days a week for a lunchtime food service. They also provide a food bank to individuals that they can access 6 times a year, so once every 2 months. And then the Anglican Church also offers a soup kitchen 1 day a week. It's not year-round. So essentially there's a community soup kitchen 5 days a week. There's no food over the weekends. There's no food in the evenings. And we had to discontinue our community food program, which was a loss of 40,000 meals a year to this community. And there's a lot of people who would access that who are living on the margins. There are seniors living in poverty who are spending the majority of their income on their housing instead of food on the table. So
I've heard of seniors too. I think that it was referenced that there's a lot of seniors that are shut in, which means they're, you know, at home and they need people to either come and get them and take them to appointments, or they need meals delivered to them, or their groceries picked up and delivered. Is that a good place to start if people are really having a hard time with wrapping their heads around helping homeless, addicted? You know, would it be a relief on some of the resources in town if there was a push for, hey, let's at least adopt a senior here and make sure that there's
of course, absolutely. Food's an essential and a basic need for people, right? So.
And when we hear that housing, we kind of take a pass because we know, well, I can't go get somebody a house, right? I can't do that.
Yeah.
So if we strike off that and we leave that to the professionals and the governments and organizations that are pushing for that, and we go, okay, as an individual, what can I do today?
Yeah.
So your suggestion would be like find somewhere that needs food and get it there.
Feed people. You bet.